I am introducing a technology that may perhaps help in treating so many untreatable disorders in future. Before the invention of ophthalmoscope, the back of the eye was like a black box. Similarly, one part of the eye has remained hidden or difficult to see until fairly recently. The area behind the iris, ciliary body, ciliary processes, peripheral retina, and vitreous. The endoscope opens up this region of the globe for diagnosis and treatment. In patients with opaque media, endoscopy makes the vitreous surgery possible. I'll show you two case scenarios where endoscopy has helped in managing the patients. This was a patient where a failed attempt of foreign body removal with vitrectomy was already done elsewhere. CT scan orbit was done and a foreign body was located at the pars plana region. So the endoscopic removal of foreign body from ciliary body was planned. First, the phacoemulsification was performed in an attempt to visualize the foreign body through the conventional microscopic view during vitreous surgery, but this was not possible. So then the endoscope was inserted, and this is the view through the endoscope. This is the peripheral cut edge of the vitreous. This is pars plana region. You can see the ciliary processes here. This is the posterior fundus, optic nerve, and the macular area. This is the view with the 20 gauge endoscope. Again the peripheral area. I am trying to locate the foreign body. Here you can see the iron foreign body lying at the pars plana region. This localization was not possible easily with conventional system, even with depression. Now I'll try to lift this foreign body with the help of intraocular magnet. But because of the adhesions, the foreign body is not coming with the magnet. Now I'll use the cutter to remove the adhesions around the foreign body. This is the cutter used to remove the vitreous adhesions around the foreign body. Now again with the help of magnet, I am lifting the foreign body. Now the foreign body will come with the magnet. All this is now again the foreign body is stuck at the sclerotomy site. The sclerotomy site will be enlarged with the help of MVR blade. In this process, the foreign body falls again in the posterior pole. This is the foreign body lying at the posterior pole. With the help of magnet, now this foreign body can be removed with the sclerotomy that has already been enlarged. In ophthalmology, if we cannot see the problem, we cannot fix the problem. The endoscope offers us another set of eyes, allowing us to treat patients that we could not have treated otherwise. This is another case scenario of intractable neovascular glaucoma where endoscopic cyclophotocoagulation is planned. Entry wound is created at the limbus. The helon is injected under the iris to make the space for the endoscope. This is the endoscope entry, and this is the undersurface of the iris and ciliary process that is showing with the endoscope. All this I am visualizing on the screen in front of me, not through the microscope. These are the ciliary processes, and this is how the photocoagulation is done. You can visualize photocoagulation of the ciliary processes here. This is the entry from other side to treat the rest of the ciliary processes. For many years, cyclodestructive procedures have been used to treat refractory glaucoma with the goal of diminishing aqueous humor production by ablating ciliary processes. Since the surgeon is not able to assess the targets being treated, adjacent tissues might be damaged during the procedure. With the laser endoscope, one can very precisely and selectively treat the ciliary processes under direct visualization. Helon is being removed and the end. Endoscopic cyclophotocoagulation is an effective and safe procedure for refractory as well as routine glaucoma. Endoscope is a useful adjunct in every vitreous surgery. There is definitely a learning curve and it takes time before one gets comfortable with the lack of stereopsis and shifting perspective. It allows excellent visualization of the region behind the iris as well as the vitreous in eyes with opaque media. Looking towards the future, no one can say what further application will be found for endoscopy, but it is a useful tool with great potentials for innovative uses. Thank you.